my patients is how long do I have to be treated for? So I wanted to discuss that. There's a couple things to keep in mind that actually how long a person is under care depends on two basic things, and those are how messed up you are in the first place and what standard do you want. For example, someone comes in, young person, they come in terrible pain, aching, screaming. They lifted something wrong at the gym, but basically are in really good shape. If they don't have a lot of arthritic change or background, there are a few visits. They'll probably be okay if they don't get stupid and go redo what we just told them not to do in the first place. Short-term patient, how many visits? 3, 4, 5, 1 to 6. Not that many typically gives a pretty good bit of relief. What if, though, we get somebody that's 40 years old and they've got some arthritic change and they've had a car crash? It's not very realistic to think that 3 visits is going to automatically get them out of pain. Now, what we see that people's expectations from the kind of miracle cure and also the insurance company mentality right now look for very unrealistic expectations in pain relief. If you get someone, to extend this out a little more, if you get someone 60 years old, now they've got significant wear and tear, there's multiple injuries, they're on half a dozen medications, possibly a type 2 diabetic, maybe their circulation isn't very good either. But I see it every day. It's like, my goodness, 3 visits and I'm not as good as I was when I was 22 years old. Sorry guys, not going to happen. Not very likely. That's going to be a much harder fix. Part of it is everything connects to everything else. So if you come in with a crick in the neck, you'll walk a little bit crooked, then you have a bad back, then throw in the arthritic knee. All those things interact. And it's just plain silly to expect that there's going to be an immediate pain relief that's all going to last forever and ever and ever. It's true, everybody wants that it costs no money, takes no time, never hurts, has no side effect, perfectly safe, and it should be instant overnight. Welcome to Fantasyland. The other part is, what standard do you want? Some people, I've heard this as a quote, someone's standards aren't that high, which means they said, when I asked them, what do you think your general health is like? And the quote was, well, at least I'm not on as many meds as I am as my neighbor. They get, boy, that's setting the bar high. But some people, all they want is short-term pain relief. That's it. Then they'll come back. Then they'll come back. Good part of that? Yeah, less visits, less money, but also less effect. We can get good pain relief, but until the system is balanced out, there's a great danger that it's going to relapse. You have no stability. We might prescribe people to do homework, take care of themselves, which quite honestly more people should do and many people don't. But if they did, they'd have much better results. Other people, oh no, that bar is high. They want to perform well, they want to age well, they want to live large, and they want to do very, very well at everything. They're going to need more care too. For example, I've been blessed to treat some extremely high-level athletes, Olympic gold medalists, people in record holders in powerlifting, very gifted martial artists, some track and field, well, and a couple of gymnasts. They're just unbelievable what they can do. But for them, they need to be at 98% all the time. Every little bit. Muscle test for injuries, and we try to prevent injuries from ever really taking root. So for them, the bar is exceptionally high. They need more care too, because when they start to hurt, it's actually too late. We have to prevent that. So we find subtle structural changes, imbalances, weakness patterns. If we can correct that, we've got a gymnast that won't fall off the high bar or will have some spring in the step and all those things. But there you have it. It's a combination. If your old person is reasonably young, pretty good shape, eats right, which is always an important thing too, because you're only as good as your building blocks. Typically, it's not a lot of visits as far as pain relief. If there's a long history of things, that is not going to be overnight, and it's not very smart to even expect that it will be overnight. For people like that, maybe medication is a better fact. It takes the fire extinguisher approach, loosens it, but doesn't fix anything. Motion doesn't improve, overall health doesn't improve, but there's some pain relief. If you set your standard high, you have more care, and in addition, you take initiative to take care of yourself. In summary, it's a team approach. You put a high standard, demand a lot out of yourself, you just might get it. That's it.
Okay. You stopped it?
No.